Hello, and welcome to Real Menopause Talk. My guest today is Dr. Terry Loong. Dr. Terry specialises in hormonal acne, aesthetic treatments and hormonal balance, especially for perimenopause and menopause. She's a working mother with an impressive list of medical credentials who understands the pressures and stresses of modern-day life, and someone who fiercely believes you should do what you need to do to make you happy, without fear of judgment. Eat well, rest well, love well. We met up so I could hear more about her story and learn some more. Lovely to meet you. How are you?
I'm very well, thanking yourself.
Good. Yes, very well. Thank you. Starting off, I know a little bit about your history, but it sounds incredible. Please tell everybody all about yourself.
So what can I start really? So currently I'm an integrative aesthetic and hormone doctor. What that means, I help women kind of feel more confident in their skin by balancing their hormones and looking after their skin as well in terms of skincare planning and looking at treatment options if it's indicated. I actually created my own career because I started out as a surgeon. God, it's so long, more than 20 years ago, really. And then after that, I went and due to my own life decisions, lifestyle changes, work-life balance, decided to go into aesthetic medicine. And then due to my own health journey, then I went into kind of nutrition, hormone balancing. So that's kind of like where it all kind of muddled up really and created my own career.
You grew up in Malaysia and then studied in the UK and the US, is that right?
Yes, that's right. So I was born in Malaysia and then I came over to go to medical school in Guy's and St Thomas's Hospital and then merged with King's College London. And then after that, I did my training in surgery here in UK. But then when I did functional medicine, nutrition, it wasn't as popular as it is now in UK. So I went to the States to spend some time there.
What drove you to transition from surgery and aesthetics into functional nutrition and naturopathy? How did you make the blend between the two?
I'm always, because I think at that time I always consider myself always like in the middle of like the science world and as well as that alternative complementary world. And I've always been slightly interested in that. And I think when I fell ill when I was 30 years old, I was diagnosed with early stage cervical cancer, which was luckily treated and then I'm completely, clear now. So at that time I realized that, okay, it's not just good to look young and clear a wrinkle, but I need something more. So I went and I didn't want to do medication or at that time. And so I went and explored nutrition, explored that. And then from that, at that time, I was seeing a lot of patients with acne. So then I went on to write my first book called The Hormonal Acne Solution, How to Clear Hormonal Acne Without Medication, Antibiotic Birth Control Pills over Accutane. So that's kind of started my love for hormones in relation to skin. And then as I grew older or wiser, I grew wiser and as well as my patients as well, then I started looking at more perimenopause, menopause as well, because it's kind of in keeping with my my journey with my life and as well as my patients really. Yeah, so that's kind of like where the journey started.
And did it start just a tiny little bit before that from the inspiration of your mother?
Yes, it was actually. So my mother, I'm the eldest of 7 now because my mum, we had 5 of us and then my dad remarried and then I've got half brother and half sister. So, but my mum, she was one of the most positive, hardworking woman that you would ever meet. Those that when you see from afar, I think, oh, how does she do it all? She was a working mom. She was like the best daughter, best wife, best mother. That kind of like awarded mother. But unfortunately, I lost her when I was 19 years old. She was only 46 years old. But she taught me a lot because in her 40s, she gave up her kind of marketing director job in a big departmental store to work from home when my youngest brother was born. And then she started her own business, clothing line. And then she she took up playing the flute, went to university to learn Mandarin, so all the things in her 40s. So that kind of inspired me. It's like, you can completely evolve in that, even in later part in her life. But also, I remember her, she used to like cook herbs for me when I was sick. So we were never one for medication, even though I'm a doctor, which is weird. I'm a doctor. We try our best not to take medicine really, in terms of drugs, if we can help it. So she used to give me like herbal tonics, herbal soups, everything herbs. And she would take me to see the Chinese medical doctor, take my pulse, check my tongue, and do acupuncture. So I believe in all that complementary and alternative health. And I think it's a really good combination, good marriage, really, if we can combine the two.
I agree. I'm a massive fan of acupuncture and Chinese herbal teas. I have
Yes.
no idea what goes into them, but they work wonders. They're
Yes.
amazing. Whereabouts are you in terms of menopause currently?
So me personally, I'm in perimenopause, really. So the time leading up to menopause. I'm 43, but 44 this year. Like I said, perimenopause is a difficult diagnosis to make because it's all symptom based and it's not really by blood test. But last summer of 2021, I was really feeling the difference in terms of my energy levels, my motivation, brain fog. I was just, and just feeling depressed, even though it was summertime, and just no sex drive whatsoever. And then I realized, I was feeling very emotional. I mean, I'm quite a emotional person anyway, in terms of that, PMS time, cry of when we movies and everything. But this was like ridiculous, really, out of the blue, anxiety and palpitations, hot flashes, night sweats as well. So, and then I had some blood tests, and then it confirmed it, and so I started taking HRT, really. So that's where I am in terms of the perimenopause. So on the HRT, I'm doing like a cyclical protocol, so to try to mimic me having a period.
And are you taking just the progesterone and estrogen, or are you taking
I'm
testosterone
taking
as well?
testosterone as well, androgen. Yeah, I only just started taking testosterone actually because I did another test and it was just low, much lower, and so I'm taking the androgen as well because naturally I'm prone to acne, so I was very careful not to start on testosterone straight away. So always start with the estrogen as well as the progesterone before I did the androgen.
An awful lot of people seem to almost forget or look at testosterone as the last resort, or
Yeah.
it's not as famous as
Yes.
progesterone and estrogen. But
True.
I do feel that it is just as important. Are they all on an equal level in terms of skincare?
They all work differently. So the skin, apart from anatomically, have the three layers: the top layer, epidermis, dermis, which is all the collagen, elastin, and the subcutaneous, which is the fat pad that gives our face, the volume as well as the contour and shape. Our skin also has receptors to hormones as well, not just as a target for hormones, but it also produces its own hormones, and it also can activate and deactivate hormones as well. So that's quite interesting in terms of how hormones relate or affect skin. And how the hormones affect skin, I would like to, how I explain to my patients that if you look at estrogen, I call her the diva hormone. It's diva, it makes you feel sexy, lush, juicy and plump. So it's really important to maintain the skin hydration, maintain the skin plumpness, firmness, because it produces collagen and elastin. But it's also in charge of producing melanin, the color of the skin, the glow. So all that gives, like the diva, making you glow, really. So that's kind of like the diva hormone. The progesterone is the calming best friend. So you need her as well to calm things down. So when skin is breaking out or rosacea or sensitivity, the skin, then we need more progesterone to calm things down and calm the redness down, calm rosacea. And then testosterone is really more of, I call her or call him the bad boyfriend. You need a little bit because it's nice to feel confident, you feel sexy, but too much you might feel a bit sleazy and acne and kind of greasy hair and baldness. So testosterone is important because it firms up muscles, and our face is not just skin, but it's also muscle as well as bone and subcutaneous tissues. So the muscle is important to keep its tone, and keep the
Mhm.
face kind of looking kind of youthful, really. So they all work in different areas. And interestingly, there was a study done in Edinburgh that looked at skin concerns with women coming for menopause, and almost about 45% of women saying that they complained of skin concerns. And I've never met anybody, or there's no report saying women actually go on HRT for skin concerns, but they often say that, once they're on it, then they don't want to come off it because they notice the change on the skin. They kind of like almost like put a halt on like the aging, because especially like collagen in the first 5 years, we lose 30% of our collagen because of estrogen drop of menopause.
Right.
And then after 5 years, then you drop another 1 to 2% every year. So there's a lot of my patients, maybe they tell me, I don't recognize myself anymore. Or they just suddenly feel that in the last 6 months, they just age so fast, 5 years or 10 years, and noticing, especially skin underneath the arms, a
Mm-hmm.
bit crappy, a bit loose, or skin on the knees, a bit crappy and loose as well. And then, on their face as well. So that's kind of like what they notice that can affect the biggest change.
So, how do you help the women that come to you in perimenopause or menopause?
Depends on what they come to see me for, because I, in a way, bridging the gap between, I look at skin, I look at anti-aging concerns, and I look at hormone balance as well, but not just hormone balance in terms of prescribing HRT if it's indicated, but I help women to, how can we improve your gut health, balancing your hormones, your sugar levels, and how can we look at herbs if we need to, whether it's the right thing really, So depends on women what they come to me for. So some women come to me straight away because they're bothered by the skin first, because that's what they see. They might not think their other symptoms are related. So with the skin, then I work with them. So okay, let's look at what can we do in terms. Can we look at your skincare planning? Do we need to change things up? Is it too active? Is it too aggressive? Is it too dry? Then we can look at aging concerns. Does that bother you, or do you want to talk about it, or look at treatment options? Because I don't think anything is bad or good. It's just like where are you at with it really? And if the more you educate yourself, then you at least you're empowered to make that decision yourself. And at the moment, and with the hormones, some patients come to see me because they feel that they just have the brain fog, just the energy levels are really low. And then with the energy levels are low, they just don't have motivation to, eat healthily or go to bed, or, they kind of feel they numb themselves with the alcohol or with TV or with social media, and, really stressed, and they can't really manage their stress. So I help them. And then, on top of them, I always say, if we can manage your hormones, balance your hormones, the skin is a bonus, to be honest, really, So that's kind of like how I work with patients. I mean, at the moment now, patients can, if they want to work with me one to one, I do like a 12-week program. And it's kind of like a container, so I can work with patients quite intensively, and potential patients, women can schedule a discovery call with me to see if it fits really. Because with hormone balancing, skincare, and wellness, women's wellness, I think it's a partnership between the practitioner as well as as well as the women, really. As much as me guiding them, but it's also women have to do majority of the work. So it has to be a partnership.
What are your own key pillars for self care and gut health and skin health at this stage of life?
I think the three simple things I would say is eat well, rest well, and love well. If you keep those categories, so eating healthy food, but not just eating healthy food, but making sure you're absorbing it as well,
Mm-hmm.
really. So if you're investing money on nutritious food, but if you're not absorbing it well, because either you're rushing through your food, or you're not, cooking it properly or preparing it properly, or you got gut issues, or you're not detoxing, so you're not actually absorbing it properly. So kind of eating well, that kind of like sits at a whole category. Resting well is a big thing, because it's a balance between the rest and repair and the wear and tear, really. And if you're resting, it's not just sleep, but resting throughout the day. As women, we are cyclical beings, so we change throughout the month. Yes, with our menstrual cycle, with the fluctuations of the hormones, but we change throughout the day as well. We wake up one person, and at the end of the day, you're another type of person. So it's kind of like resting and working with how you work best, and making sure you have regular rest throughout the day, and which season you are, whether you got little kids, teenagers or adult kids, really, whether you got partner or no partner. So that's kind of like resting well. And then loving well, it's more like loving yourself, but also loving what you do, loving your work, loving your job, loving your friendships, relationships, because all that, although it might not be tangible, it's also very important towards balancing hormones.
If somebody comes to you for facial treatments,
Mhm,
which you do as well, obviously, and the
mhm,
aesthetics,
mhm.
if it's for the first time, what advice would you give them?
If it's the first time and they're in clinic with me, usually by the time they come to see me, if it's their first time, they would have thought about it for a year or two. So
Gosh, that's a long time.
it's a long time, so they would have done their research, waiting to find the right person to work with. usually in the first consultation, I'll give them a mirror and they'll ask them, what bothers you now? What bothers you at the moment? I mean, they always say, what can you do for me? I can do a lot of things, really, but it's a question of what bothers you now. And then we can address that first. And then later on, we can discuss things, really, But it's also not just focusing on one line, but looking at why the face became what it is, or how the face aged to result in the line, and also planning for the future. So not just addressing the concerns now, but addressing for the future. Because let's say, for example, which happens as we age, when our estrogen drops with menopause, we lose collagens, so our skin becomes like loose and kind of more going south, if you like. But the bone structure changes as well. So our cheekbones flatten, our jaw bone shortens, so we get the jowls, we get the flattened cheek. So instead of injecting filler in the cheeks, for example, because that's we got flat cheeks, so let's put it down. But it's really more repositioning your tissues. So we're giving a lift rather than adding volume, where then it might look odd, really. So it's not just addressing the specific area, but really looking at as the face as a whole, and how we can address concerns now, but also prepare your skin or prepare your face as it ages in the future.
So if the bones move, then you can still address that in that you can refresh somebody.
Yeah, absolutely. I mean, the bones doesn't really move, but it changes density. Density. So like the cheekbones flatten and shorten, so our cheeks go a little bit flat, and then because it's flat, so there's nothing to lift our laugh lines up, so then you get more of a laugh line fold. And then under eyes as well, then we start getting more darker circles under the eyes and more hollowness, because the cheeks add as like a support underneath that. So all that kind of interplays with it as well. So the jaw bone, if it shortens, then there's no foundation or less foundation for your jaw tissues, so then you get more jowls, or you get undefined jawline. Or maybe they start noticing the chin starts to shorten, the chin bone, then you start maybe noticing more double chin, more crappy skin underneath the chin. So there are a lot of things that we can potentially do. I explain things basically to the patient, but I always send them away after the first consult, because it's their first time. So I was like, I know there's a lot to take in, so go away. I'll send them a summary of what we discussed. It doesn't mean we have to do it all in one go, because it's not a sprint, it's a marathon, and also it's a building a relationship thing. I'll send them away, giving them a summary. Which one do you feel that you want to start with first, in terms of the biggest, do baby steps, really. And then later on, then we can work on the bigger things if it still bothers you.
So you just have to kind of rebuild what might have...
Yeah, but then what you were. So in a way, like, I'm not changing the way they look. It's more like restoring your youthful features. Just restoration.
Magic. What would you most like to change about the way that perimenopause and menopause are viewed in the outside world?
I think one of the things is, especially perimenopause shouldn't be so taboo. I think especially in women in their 40s, we go through so much life changes, career change and everything. And sometimes the perimenopause, because we have less patience, we become more anxious, we're not sleeping well, so things are worry and everything. The worst thing, stress makes perimenopause worse, but perimenopause makes stress worse. So it's kind of like a chicken and egg thing. So it's kind of accepting that women could be going through that and seek help sooner than later, and not saying that you're mad or you need therapy. I feel everybody would benefit from therapy, but therapy could be working with a nutritionist. That could be therapy. I really believe, like, do work with somebody if you feel that it's difficult to get all your healthy habits. And that's all we really need to get the basics right. Don't overcomplicate things. This supplements, that supplements, HRT, and everything. Educate yourself, definitely. And also HRT is not evil. It has a place to play, and a very important role to play. So it's kind of like educate yourself so that it's not dangerous, so that when you need it, you can seek the help that you need, really, so that you don't have to do any needless suffering for yourself as well as the people around you. So that's kind of like what I want to help change.
Yeah, I couldn't agree more. You don't need to suffer. Yes, we can be stoic. Yes, we can endure, but we don't need to.
That's true. I think probably adding on, follow on your comment about, being the stoic. And I wonder whether it's from our upbringing, saying that we just have to push through things. When I saw my mother push through things. And I mean, now people are talking more about hormones, but it's kind of like even, having treatments, skin treatments, facial treatments, you're just, oh, you're growing older. It's fine. Just age gracefully. But it's kind of, so it's the concern of people judging, really,
Yeah.
when you decide to do, oh, HRT, oh, it's dangerous and everything. So it's kind of like almost coming back and realize that you're in your 40s or 50s and you're a grown woman. So you do what you want to do and do what you need to do for yourself, really. So
Yeah.
that's what I would say at the end.
The fear of judgment is very strong, and it's something that's kind of taken me by surprise, because I'm 48 now and feel that I should be able just to do what I do. And if people judge, that's fine. I
Yeah.
just let it wash off my back. But with aesthetics in particular and HRT, there do seem to be two camps. It's either the yes HRT, the oh no, and for example, Botox. If you know, you know. And if you don't, you don't.
Yeah.
And if you don't, you possibly judge.
It's a difficult one, because I sit in the middle, so in my social media, I have followers who embrace it, if you like, are very open to it. And there are some who are like anti, really, or, some will keep an open mind, so when I do write about it, I always say it's an option. But also don't forget Botox, we use it for migraines. And if you have migraines when you're in perimenopause, menopause, why are you suffering with migraines? Botox is an option. It's a licensed treatment for migraines, so it's an option. So why, you don't need to suffer. And so again, is that whole thing is like, no, I have to hold on, I have to grit it. It will pass. And yes, it will pass. But like, again, why do you need to suffer? Intentions are so important of doing something. I think everything you do, there is a choice. The choice is yours to make and not feel it's some other judgment. And I think in 40s, I think it's a great time of shedding, releasing, those judgments. So even though it's uncomfortable, the perimenopause stage, but I think it's a great time. You kind of let go of things that you no longer have patience for.
Is there one piece of advice that you would give a woman who thinks she's in perimenopause?
So a good thing to do is download a green climateric scale. It's a questionnaire of like a list of symptoms, and it's basically symptoms that is suggestive of menopause and perimenopause. If you've got quite a lot of those symptoms, bring it to your GP and ask, I have all this list of symptoms and I'm really concerned that I may be in perimenopause. Unfortunately, there's no blood test that can diagnose it because our blood levels fluctuate. There are things that you can do depending on who you see. So if you see your GP, they might just do a simple blood test. If you go and see a functional practitioner myself, then we do different testing, like a urine test or saliva test. So it's different. But you don't need a fancy test to diagnose, really. If you have the symptoms, if there is a suggestion of perimenopause, and especially if your periods have changed as well, then there is no reason why you can't start on HRT as long as you don't have any of other risks. So assessing the risk profiling is very important. Then you start and see how you feel as well. But of course, during the time, work on making sure your diets and your movement, your sleep, all those come into play. And that's why sometimes it's difficult. I understand if you're going to see your GP, they only have 10 minutes with a woman. Usually you're only allowed to bring one symptom to the table at any one time. And with perimenopause, it could be a lot of symptoms. When you go and see your GP, say, look, I've done this questionnaire, these are my symptoms. I've noticed my periods have changed, or my periods have gone heavier or lighter or shorter or longer, doesn't matter. If it's changed, I'm thinking that I may be in perimenopause. I want to find out about HRT. I want to look at HRT, really, They can even go to the website British Menopause Society as well, BMS, and they've got a lot of resources for women in different stages. And then you can always download the articles, or the guidelines and bring it to your GP, because some GPs will be trained in this field or they will specialize it. They have interest in it, but some of them don't. And they feel that for women in their 40s, okay, antidepressants will be the answer, which is not. Really. So no antidepressants, or it's in your head. No, it's not in your head. I think if you have that, just a few things to bring to your GP, that will lower down the resistance for them to consider looking into HRT for you.
And to round off, any advice to the men out there?
Be patient with your women. Be patient with your women and know she's going through transition and just breathe and listen. We're not trying to find solutions because I think women, we know what we need to do. To be honest, we've got really good instinct. It's just kind of like, how can we remove the distraction? Be patient with them, listen to them, and take care of them. Take things off their plates if they don't need to do it. Help them de-stress.
Thank you so much for
You're
your
very
time,
welcome.
Dr.
You're
Terry. It
welcome.
has been lovely to meet you.
Absolutely. Thank you so much, Hattie. You
can find Dr. Terry at drterryloong.com and on Instagram, Dr_Terry_. I will leave all the details in the show notes. Follow us on the podcast apps and spread the word. The more stories we share, the more we normalise the menopause and the stronger the support. Thank you for listening. I look forward to seeing you in the next episode.